Okay, guys, so I've got a couple clients that have knee replacements at this point, and especially coming back from a knee injury or an issue or a replacement, a surgery, whatever else. A lot of times we're able to get back into activity and exercise, but in that process, we're not quite fully back to restored strength in the knee. Also, our body is smart, um, so it protects, right? So what ends up happening is we start to stabilize and guard with other muscle structures around the area. So in this case, if my left knee is the affected knee, I might start to guard in my left side of my low back, my left hip, something there. And so as we're trying to get back into activity, that can be difficult to kind of, all right, well, did I create a new problem or whatever else? And so giving you some tips and tricks to avoid this, but like a typical hip flexor stretch doesn't necessarily work because we have some issues with like kneeling on the knee. So if I was going to do a normal hip flexor stretch, I would be here and I'd have that kneeling down. Now, most of the time with a knee replacement, the patient's encouraged not to kneel on that side or kneel in it for a longer duration. So even if a pillow underneath it, whatever else. Now, could they have to do that at some point based on like an emergency type situation? Sure, but we're not going to set them up into a stretch that way. So one way we can do that is we can just be in a standing position and kind of get in this staggered stance. Now, if you're someone that struggles with balance anyways, as an older individual, like I've got clients that work with us in their 70s and 80s, and so maybe balance is an issue, you can always have something to kind of hang on to, a post, a wall, a door frame, something like that. Okay, but I'm going to have something to hold on to. I'm going to stagger my stance. I'm going to lean forward with that straight leg. Okay, so my back knee is straight, and I already feel this into my hip. And then the addition to that is I can bring this arm up and then just lean forward, and that increases that stretch exponentially. So hip forward here. If I don't need to hold on to something, great, but as I start to lean, I kind of like to have something there so it can stabilize me, and then I can get into that stretch more, and then I'm stretching through here. The other thing I want to concentrate on is squeezing my butt. Okay, so squeezing that glute to take all the slack out, and then keep my belly tight as well so that I'm not arching my back and feeling the strain back here, because a lot of times people lean forward and all they've done is position their hips forward and then they've jarred kind of that low back area. So tight hip here, loosen up this front side by stagger stance, straight leg, lean into it. Then I can increase that stretch by leaning over into this guy. And now that even gets incorporated into the outside of that hip. So that's the stretch I would give someone. When I'm holding that stretch, I'm looking for change, right? So it's not just like hold it for 30 seconds. It's hold it long enough to create a change, at least a 30 count of that. But then also, I really like to hold for that 1 minute time frame and then doing it for a few sets. If I stretch the first set and then I go back to stretch it again and there's really no change, then I need to keep duplicating that set because we want to create lasting change. If I don't, it's like a rubber band. If I just stretch it out real quick and then snap it right back, it goes right back to the same position. We want to create long-term change there. The other thing that we can do aside from that is some soft tissue work. So I've got a lacrosse ball here. You can use actually with like a softball size because softball's a little bit bigger, a little less pinpoint on the area, but you can use a lacrosse ball, a baseball. Like I said, a softball's a little bit bigger diameter, and so I like that over the mass and the structure that we're going on. But you can do this on the ground. You can use your foam roller as well and roll on the ground. So if I was setting up my foam roller, I got to be honest, I didn't bring my foam roller out here for my video here, but my foam roller is actually going to go sideways here. I know I'm getting down, okay, but I'm going to lay that foam roller right over my hip pocket, and I'm going to stick right here. It's just like, so I notice how I'm flat on the foam roller, and then I'm just going to turn to the side just a little bit, and this already lights me up, okay? So what I'm looking for is like this area that my pocket like goes into. So here's the pocket of my pants. It's like this area right here becomes this gnarly area. So in here, I'm not necessarily going to roll on. I'm going to roll across this side here. And so I lay on that foam roller, get over top of it, and then I just kind of roll my hip this way. And then I'm just going to hang out there. I'm going to do short passes, and I can roll side to side. We forget about this, like what I call a kind of a cross friction. So if my tissue's going this way, I'm going to roll back and forth over it a little bit. I like to do the foam roller prior to stretching, and I like to do the foam roller work prior to a workout because that's priming a little bit, give me a little bit of extra blood flow in the area rather than static stretching. But if you've got a really tight hip area and you need to get some motion in it prior to a workout, you could foam roll and you could do that hip flexor stretch. The other alternative is if you don't want to get onto the ground and you've got one of these balls, so you can use the wall, and I pin that ball right up against the wall, between the wall and my hip, and I hang out in that same area. So again, you can't see because I'm facing the wall, but I'm in this pocket area here. And then the other piece here is like, I find a lot of tension is found in this like glute med area. So here's your big glute mass here, right? So I've got this big area here. If I slide all the way up here, it's like this hip pocket. And what I've noticed is if I get a client to put the ball right there and push against the wall, what they do is they hit this just trigger point right there. And that's all this tension that's built up. And again, a lot of times, so I get right there and it's hitting me right now. I don't even have a knee replacement, right? But these muscle structures get challenged so much because they're guarding and protecting and they're stabilizing while that knee or that affected structure is recovering, healing, and getting stronger. So it's not wrong. You're not doing something wrong that these other muscle structures are getting tight or irritated, but we do have to have a little bit of an additional TLC to it to kind of combat some of that guarding or that protecting. The soft tissue stuff, again, prior to exercise, I think is really helpful. Don't spend a ton of time on the soft tissue stuff too. 2 minutes max on any one area, because just like anything else, you can get more sore from this. So we don't want to beat up the tissue over and over again. But if you get a couple of minutes on each area and do that on a daily basis or an every other day basis, especially prior to exercise, and then also complementing the stretching side, either post-workout or after the foam rolling, once you get a little blood flow in the area, this stuff can really help out as you're kind of recovering and getting that body back from a surgery or from an affected issue with the knee where these other areas are flamed up. Hope this helps. If it does help, please let me know. And you can also share this with a friend if you've got a friend, a relative that's had a knee replacement, had a major knee surgery or something like that, and they're struggling with some other areas in their body that are tightening up and guarding because of that. Take care, guys.